Now let's start learning to become capable of performing BLS. The first step is to learn the necessary knowledge. This is a CPR algorithm chart for dogs and cats published by Recover. Following this chart, we will look at the Pet BLS process using the training equipment. Everyone taking this course can refer to this video as an example when submitting their videos for the exam. First, let's look at the process.
部長部長誰か来て。お兄ちゃん、動物病院に連絡して。お姉ちゃん、タクシー呼んで。
This is the Pet BLS that you will learn for this certification. Let's look at the same video again, this time with commentary. When your pet is passed out and it could be having a cardiac arrest, position yourself behind its back. First, check for responsiveness and breathing. In order to check for responsiveness, try calling out your pet's name or touching its paws. If there is stimulation by voice or sound, or stimulation to the limbs, its eyes, ears, tail, or mouth will often show signs of responsiveness. Caution: do not pick up your pet as it will make it difficult to observe their reactions. You can also check by opening its mouth. In that case, you can try it by holding the pet's upper and lower jaws. If it doesn't open so easily, that's a sign of responsiveness. If it opens easily, that means no responsiveness. Next is checking for breathing. Check for rising and falling movements in the chest and abdomen. Either check the rise and fall of the chest from eye level, or place your hand on its chest. Caution: do not make a judgment by feeling the pulse. It is very difficult to judge by feeling the pulse, and it is said to be accurate less than 15% of the time. Agonal respiration. Agonal respiration is a state in which the mouth is gaping open like a goldfish. There's no rise and fall in the chest, so do not mistake it as a sign of breathing. It may be relatively easy to determine if there is breathing, but it's very difficult to determine if there is no breathing. It's a good idea to check and remember how your pet breathes when it's asleep. Absence of responsiveness and breathing should be determined within 15 seconds. delay in making this judgment decreases survival rates and may cause serious adverse effects, including deterioration of neurological conditions. Initiate CPR immediately upon determining the absence of both responsiveness and breathing. If you suspect an absence in responsiveness and breathing, even if you are unsure, initiate CPR immediately. Even if you perform CPR when your pet is not suffering from cardiopulmonary arrest, the damage from CPR is small. If you suspect an absence in responsiveness and breathing, it is better to perform CPR without hesitation. Next is chest compressions. First, I'll explain the basic points of chest compressions. Please study to understand the main points rather than memorize everything here. We'll go over the points again during the practical part in the latter half too, so don't worry. Positioning of the animal. Lay your pet on its side when you perform chest compressions. This allows more force to be applied to the left ventricle and increased aortic blood flow according to experimental data. This applies to both dogs and cats. Cats can have their hearts compressed more efficiently by laying them on their side too, and it has been shown that ROSC is more likely to be achieved. Both dogs and cats should be laid on their side when you perform chest compressions. You can lay them on either side. When performing chest compressions, the positioning is based on the cardiac pump theory. In the cardiac pump theory, compressing the chest, which is directly above the heart, also compresses the heart, or in other words, the ventricles. And the heart is located right here, where the pet's elbow bends and attaches to the sternum. It's slightly above this area here. Place your hand like this, with one hand grasping the heart around the stomach from the front. Put pressure on the entire area in contact with your pet. Caution: do not put pressure only on your thumb. The hand on the back that is not used for compression should be secured against the back to prevent it from being pushed. If you get tired, you can use the two-handed technique, but if there's anyone else who can switch roles with you, prioritize that. Be careful not to push too hard with the two-handed technique. Dogs and cats weighing less than 5 kilograms in particular may suffer from rib damage and lung damage, so take great care when using the two-handed technique. Depth of chest compressions. The depth of compression should be by 1/3 to 1/2 the chest width. What you need to be careful of here is, this does not mean pressing down to 1/3 of the width. What's essential here is chest recoil. Chest recoil is when you release the chest back to its original position after compression. Starting from the normal position, push down by 1/3 to 1/2 of the width, release it to its original position, and then perform the next compression. If the chest isn't pushed down properly and it hasn't returned to its original position, the compression will not be effective. Always remember the chest recoil and release it back to its original position. That's it for chest compressions. In the case of small dog breeds, such as Chihuahuas and miniature Dachshunds, as well as cats, you can apply the same method that we have discussed for the toy poodle. In contrast, for medium dog breeds and larger, in addition to the cardiac pump theory, we need to consider the option of using the thoracic pump theory too. The thoracic pump theory is where compression of the chest increases the internal pressure throughout the thoracic cavity. This indirectly compresses the large blood vessels and causes blood to flow away from the thorax. For medium dog breeds and larger, we need to choose which method to use based on the shape of the rib cage. On a side note, the line separating small and medium dog breeds is a body weight of 5 kilograms. Dogs weighing less than 5 kilograms are small dog breeds, and dogs weighing 5 kilograms or more are medium dog breeds. Now, which type of chest shape does your dog have? For example, there are round Shiba Inus and slender Shiba Inus. Choose a thoracic pump theory for barrel-chested Shiba Inus with a round chest. On the other hand, choose the cardiac pump theory if the dog has a deep chest. When in doubt about the shape of your pet's chest, consult your vet. The major difference between these two methods is where the pressure is applied. For the thoracic pump theory, push down here where the top of the front, back, ventral, and dorsal sides meet. When placing the training equipment, place the cube like this. The cardiac pump theory uses 2 hands to apply pressure just above the heart. The compression position is as shown in this illustration. It's slightly above where the elbow bends and attaches to the sternum. The training equipment should be adjusted and placed like this. If you're unsure of the positioning, go back to the Learning Knowledge chapter and look at it again. This may vary depending on the dog breed. Deep-chested dogs such as Greyhounds, Borzois, and Salukis should be laid down on their side. Place your hands right above the heart and apply pressure. Dog breeds such as English Bulldogs that have a flat-shaped and broad chest. Lay them on their back, place your hands right above the heart and apply pressure. The hand position is very different from that of small dog breeds and cats and should be placed like this. Open one hand wide, place the opposite hand over the back, and place it over the target's compression position. Apply pressure on this area here of the bottom hand. The rescuer's posture. The rescuer's posture is also very different from that of small dog breeds, and it's similar to CPR for humans. It looks like this from the front. Keep your hands in the center of your body. Keep your elbows straight and spread your knees shoulder width apart. This is to ensure that the pressure is transferred evenly and that you keep your balance. It looks like this from the side. Keep your elbows straight, not bent, and your shoulders perpendicular to the compression position. Caution: the shoulders should not fall backwards or forwards too much. If the shoulders shift back and forth, the pressure will be applied at an angle and will not compress the chest properly. If the animal is placed high up, like on a bed or a table, place a step stool and adjust the height. Depth of chest compressions. As with small dog breeds, apply vertical compression down by 1/3 to 1/2 of the normal chest width. Be sure to keep it straight and not at an angle. Move up and down, keeping your elbows extended, maintaining the angle of your shoulders, and remaining vertical. Caution: be careful not to bend your elbows. Do not perform this procedure with flexible objects like mattresses underneath your pet. Be aware that these methods do not transfer pressure correctly and reduce effectiveness. In addition, as with small dog breeds, chest recoil is vital. Release the chest back to its original position after compression. All the chest compressions that we have learned about so far for pets of all sizes move at a pace of 2 compressions per second. It's about this fast. Do 30 consecutive compressions at this speed. That's it for the basics of chest compressions.